It's difficult to say the response from two public hospitals to public concerns about persons contracting COVID-19 at public health facilities. Krista Campbell has that story.
Hospitals overflowing with patients, an increasing number of whom are COVID positive. But there have been concerns recently that some persons who go to hospital for one condition end up contracting the virus there.
You have to keep going on with between the rail, between the bed rail, between the wheelchairs, bouncing on the patient, COVID positive, and then going to the healthy patient, meaning that they don't have COVID. Because anybody come to hospital, they are really not healthy, that's why they don't come. I'm talking about if the patient is positive or not. So you have to do patients that are positive, patients that are not positive in the same gear, and maybe even you are with the gear that you're on, taking care of the positive patient, you might contaminate the next patient.
It is difficult to say whether patients contract. It's not impossible, given the nature of the high positivity rate and given the nature of the overcrowding at the hospital. It is not impossible that that would happen, but we do make every effort to separate our patients at all costs to minimize the contact between patients.
For administrators at the Mandeville Regional Hospital in Manchester and Spanish Town Hospital in St. Catherine, that includes repurposing some departments and wards into isolation areas for COVID patients and screening off those who test negative in other areas.
They're lining up. We have them trying to social distance. And from they are admitted, we try to separate them, control the source. So once we pick up that we think they're infectious, we try to separate them.
We are constantly monitoring our cleaning and portering services to see if we can achieve the highest standard to keep it as clean and sanitary as possible. Now, we are in a pandemic and there are persons moving around, so people have to be conscious of that fact and to social distance and to help us to protect themselves.
But CEO Alwyn Miller notes this is a challenge.
We do see from time to time persons come in. They may enter, we ask them to wear a mask. When they come in, they take off that mask. And that includes patients who are on the ward, where they will remove the mask while they are there.
He says the hospital is trying to hire more staff to help increase monitoring and patient care. Krista Campbell, TVJ News.